Let's look at a case that we've treated with the SmileFast Magic Braces to show you how easy and how simple it is once I teach you the basics of the course. So Catherine came in and she had significant crowding of her upper anterior teeth. When we look at the photos, she also had a deep bite, and her chief concern was the crowding of her lower front teeth and her upper right canine, which was labally positioned. She was also concerned about the rotations on her upper incisors. OPG shows no abnormalities except for her wisdom teeth being present. The lateral ceph shows us that she's a mold class 2 skeletal. Her vertical is within normal limits. Her upper incisor is normally positioned, but the lower incisor is on the high side and slightly proclined. So her initial photos, and what we've done is we've visualised from our diagnostic records what arch form do we need. So we want to bring the lower anterior teeth forwards a little bit and broaden the lower arch a fraction. The upper arch, we want to broaden the upper arch a fraction and bring back especially the upper left central incisor, which is slightly rotated. But at the same time, we're going to move the upper right lateral incisor a little lably as well. So we did an indirect bonding approach with the brackets being placed on the models. And first appointment, we bonded the upper and lower brackets. We placed some bite turbos, which we will explain in more detail in the course. We did some IPR, and we'll explain all the different methods that we do for IPR in the course. So that's day one. And it took us an hour chairside time to do that. Second appointment, you can already see the teeth straightening up a lot more. And we placed upper and lower 016 night eyes in. We did some more IPR on the lower arch and some more IPR on the upper arch, and we're aligning the teeth. The third appointment, we retied the upper and the lower. The lower is looking much, much better. We've still got some rotations on the upper central, so we've tied those in a bit tighter, and we'll teach you exactly how to tie these wires in and what methods we can use to do so and when we do it. In October, we retied and we used some very unique power chain rules in order to help derotate some of those teeth in a very quick and efficient manner. And you can see those bite turbos in place. And we'll teach you all about when to use power chain, when not to use power chain. It's very, very simple. Back in November, we placed 018 night highs on the upper and lower, and I removed those bite turbos at that stage because the bite had opened significantly. We've got some tipping that's occurred on the upper central incisor teeth, so we organised to reposition those brackets. So the brackets being repositioned. Lower arch looks fantastic, and the upper arch looks great apart from some angulation issues on the upper central incisors. But the patient's only been in treatment three to 4 months at this stage. So in January, we placed some more power chain on to derotate. And we've still got a minor issue with the angulation of the upper left central. We rebonded these teeth again to get them perfect. And back in April 2013, we removed her orthodontic appliances. And that looks pretty good. And we've placed upper and lower bonded retainers in order to maintain the stability of our result. And the arch form that we expected, that we were trying to achieve, we end up achieving. And we end up meeting our goals perfectly. So this took 9 months of treatment, and that was because we had a few little issues with the upper incisors. Normally that case would have taken about 6 to 7 months of treatment. And we did a little bit of incisal recontouring on the upper centrals just to make it look a bit more cosmetic because of the wear of the teeth. Our contact details are SmileFast Proprietary Limited, Melbourne 9524 8995 for for the telephone number. For the fax number, it's Melbourne 95328532. And for emails, inquiries@smilefast.com.au.